It is a series of vascular and cellular reactions aiming to protect the body against the injurious agent. Types: acute, sudden onset and short duration, hours, days. Chronic, gradual onset and long duration, days, years. Inflammation causes: living irritants, bacteria, viruses, parasites and fungi. Non-living irritants: physical, chemical and mechanical. Antigens: acute inflammation caused by an irritant of short duration of action. The tissue response is rapid, i.e. sudden onset. Inflammation lasts for days or weeks. Characterized by presence of fluid exudate and cellular exudate, mainly polymorph nuclear leukocytes. Cardinal signs and symptoms of acute inflammation: redness, hardness, swelling, pain, loss of function. Major events in inflammation: cellular events, vascular events, vasodilatation of arterioles and capillaries, increased blood flow, slowing of bloodstream, increased capillary permeability, margination of leukocytes, immigration of leukocytes, immigration of monocytes, chemotaxis, directed movement towards area of inflammation, phagocytosis, engulfment of bacteria and necrotic tissue, formation of inflammatory fluid exudate. Vascular events and inflammation: vasodilatation of arterioles and capillaries, increased blood flow, slowing of bloodstream, increased capillary permeability. Cellular events and inflammation: margination, immigration of neutrophils and monocytes, chemotaxis and phagocytosis. Phagocytosis: killing and degradation. Chemical mediator of inflammation. Chemical mediators' actions bind to specific receptors on the cells. Histamine, prostaglandins, CEA and C5a. Vasodilatation, increase vascular permeability. Histamine, kinins, leukotrienes. Chemotaxis, leukotrienes and lysosomal components. The inflammatory fluid exudate. Function: it dilutes bacterial toxins and chemical irritants. It brings antibodies to the area of inflammation. It brings the chemical mediators derived from plasma to the area. It contains fibrinogen, which changes to fibrin by activation of clotting system. Fibrin helps in localization of inflammation by surrounding the area. Fate: fluid exudate is absorbed by lymphatics. Fate of acute inflammation: complete resolution, healing by scarring, progression and spread, direct, lymphatic and blood spread. Chronicity. Types of acute inflammation: suppurative inflammation, non-suppurative inflammation, isuppurative inflammation. Types: to diffuse sup, inflam, cellulitis, suppurative appendicitis, suppurative cholecystitis, suppurative peritonitis, suppurative meningitis, etc. Ilocalized sup, inflam, abscess, furuncle, carbuncle. Ilocalized suppurative inflammation: abscess, carbuncle, furuncle. Abscess definition: cavity containing pus. Pus is formed of fluid exudate, fibrin, pus cells, polymorph, macrophages, necrotic tissue and bacteria. Abscess: fate of abscess, small abscess. Pus may be absorbed followed by healing. Large abscess, should be evacuated, spontaneous or surgical. Abscess, complication of abscess, ulcer, local defect on the surface. Sinus, blind and tract, and fistula, tract with 2 openings. Hemorrhage and gangrene. Spread of infection. Gangrene. To diffuse suppurative inflammation. Acute appendicitis. Suppurative meningitis. Diffuse cholecystitis. Cellulitis. Cellulitis. Non-suppurative inflammation. Guttural inflammation, E.G. Common cold. Pseudomembranous venous pericarditis, fibrinous pleurisy, fibrinous peritonitis. Serous inflammation, for example burns. Hemorrhagic inflammation. Gangrenous, necrotizing, inflammation. Allergic inflammation. Non-suppurative inflammation. Fibrinous pericarditis. Fibrinous pleurisy. Fibrinous pericarditis inflammation,